everyone, and welcome to week 1 of our course on drugs and criminal justice policy. I'm very excited about this course offering that I'm able to share with you. I've taught this course for many years at the undergraduate level, and perhaps some of you even had that with me before joining us at the graduate level. This one is going to be a little bit different than the undergrad version in that we are going to spend a significant amount of time going through crime as it relates to drug use and also the policies associated with drug use, abuse, regulation, criminalization, legalization, and much more. Let's go ahead and get started since we have a lot to do and not much time to do it in. In this first lecture, we're setting the foundation. We're looking at why drug policy matters and how the United States ended up with the system that we have today. Let's begin in the late 1800s and early 1900s, when the U.S. started formalizing control over drugs. At the time, substances like opium, morphine, cocaine, and cannabis were commonly used in over-the-counter products. You could buy a heroin-based cough syrup without a prescription. The idea of illicit drugs as we know it didn't really exist. Instead, the unregulated market allowed for the creation of patent medicines, which were full of anything and everything designed to help you feel better. That began to change due to a mix of racial anxieties, moral reform movements, and public health scares. For example, Chinese immigrants in the West were associated with opium smoking. Black Americans in the Deep South were linked to cocaine use and daily racist tropes designed to propagate against violence. And Mexican laborers were scapegoated for cannabis use. These connections were incidental. They helped justify early legal crackdowns. One of the first major federal laws was the Harrison Narcotics Act of 1914, which essentially criminalized non-medical use of opiates and cocaine by regulating their distribution. It didn't ban the drugs outright, but required strict record keeping and very restricted access. This set the stage for what would become a punitive system based not only on public health concerns, but on who was perceived to be using these drugs. In the early 20th century, addiction was often viewed as a medical problem, something requiring care and treatment. But as drugs became associated with marginalized groups and urban decline, we began to see a philosophical shift. By the 1930s, with the creation of the Federal Bureau of Narcotics and the rise of Commissioner Harry Anslinger, the language of addiction turned moralistic in nature. Drug users weren't seen as sick, they were seen as dangerous. Anslinger was a master of using media to shape perception, pushing racist and sensationalist narratives about cannabis, which ultimately led to the Marijuana Tax Act of 1937. This pattern continued through the 20th century. Every time a new drug gained popularity, whether it was LSD in the 1960s or crack cocaine in the 1980s, it was followed by reactionary legislation that prioritized punishment over treatment. Instead of investing in addiction care, the government expanded enforcement budgets, empowered law enforcement, and built more prisons. It was no longer about keeping people healthy, it was about keeping dangerous people off the streets. No discussion of U.S. drug policy would be complete without examining how media stoked fear and has influenced public opinion. We've all heard of Reefer Madness, the 1936 propaganda film that warned parents that marijuana would turn their kids into sex-crazed lunatics or suicidal maniacs. Though laughable today, it was widely distributed and taken seriously at the time. It's an early example of how moral panic shape policy, even when they're based on misinformation. There is a reading posted for this week that walks you through the concept of a moral panic and the development of the us versus them mentality that comes out of targeting certain groups. Drug users were perceived to be the ultimate folk devil group at the time. Fast forward to the 1980s, when the crack epidemic becomes the focus of national hysteria. News coverage showed inner-city Black communities that were ravaged by addiction and crime, while rarely showing white suburban users of powder cocaine. This double standard fueled fear, outrage, and pressure for harsh legislation, especially for mandatory minimum sentencing. It allows us to create the new folk devil, this time the Black American crack user who should be feared at all costs. Until the death of Len Bias, who we will talk about more in subsequent lectures. But when the number one NBA draft pick of the year dies from a crack overdose, people start to pay attention. What's important to understand is that these media portrayals didn't just reflect a public opinion. They helped to create it. They made it publicly viable to pass harsh laws with devastating long-term consequences, particularly for communities of color. This leads us to a critical concept, drug policy as a form of social control. When we look at how laws are enforced, who gets arrested, who gets charged, who gets incarcerated, we begin to see a pattern. Drug policy has rarely been neutral. Rather, it often reflects the political and cultural priorities at the time. In the 1970s and 80s, it used to be the crackdown on urban protest and Black political power. In the 1990s and 2000s, it became part of the tough on crime movement that expanded policing and prison budgets across the country. Even today, we can see drug laws being enforced unevenly. Cannabis may be legal in one state and result in a felony in another. Wealthier individuals may be diverted into treatment programs, while poorer defendants may face incarceration instead. So when we ask, why does drug policy matter? The answer is this. It's a powerful tool that defines who is labeled criminal, who is surveyed, and who is punished. It shapes not only the justice system, but also housing access, employment, voting rights, and so much more. To close this lecture, I want to zoom out and connect the history to the larger themes of this course. Drug policy is one of the most influential, yet often under-examined parts of the criminal justice system. It affects arrest rates, shapes court dockets, and fills prisons. But beyond that, it also shapes public perception of crime, morality, and race. In this course, we won't just talk about what laws are. We'll explore how they're enforced, who they affect, and what alternatives exist. We'll look at harm reduction, drug courts, decriminalization, and the global drug trade, not as abstract ideas, but as real policies with real human consequences. As you begin to think about this week's readings and discussion, consider the following. What is the role of the criminal justice system in responding to drug use? Should it be about public safety, about punishment, about treatment, or about something else entirely? We'll start answering those questions together, but I encourage you to think critically and question the assumptions you've inherited about what drug policy is really for.